Hey everyone, welcome to the Slice of Healthcare podcast. I'm your host, Jared Taylor. Joining me today is the founder and CEO of Form Health, Evan Richardson. Evan, how's it going?
Going great, Jared. Thanks for having me.
Excited to have you. Let's dig right in. First off, you started the company back in 2019. You wanted to change obesity care. Can you share what first you to take this leap, and I guess how your past experience kind of shaped the vision early on?
Yeah, it's a great question. Um, so when we started the company, it was a pretty different world, right? In 2019, nobody had heard of Ozempic, nobody had heard of Wigovy or any of the GLP-1s that are out there. And when we started to look at this space, in a lot of ways, it was clear that there was a pretty unique opportunity, but that opportunity just looked different. And I had started to look at a business in the obesity treatment space back in 2009. Had looked at rolling out a model that was at Joslin Diabetes called Y-Weight, and had an investor friend who had gone through the program himself and had tremendous results. And he said, "We got to take this every place. Come on, help me think about this." Right. And at the end of the day, back in 2009, we dug in. We saw great care delivers extraordinary results, even back then with no focused medication for weight loss, with no subspecialty of care, what is now the American Board of Obesity Medicine, or ABOM, and with pretty poor reimbursement. And so we saw that you could get incredible results with high quality care. That if you took a medical approach to obesity management, obesity care, then you could drive something really outstanding. But at the time, the math just wasn't there on the business model. You had to be brick and mortar. There was poor reimbursement, everything else. And so we saw that there's just no way to make it go up. Fast forward to 2019, of course, a decade later, everything had changed. There was now this subspecialty of care called obesity medicine, which had a board certification. There was a growing recognition amongst physicians that obesity really was a medical problem, not what had been called for decades or centuries, depending on how you want to look at the history, a self-control problem. And because it was a medical problem, there was now reimbursement, and kind of off in the foggy distance, because remember this is 2019. There were some of these medications that, early results seemed to suggest that there was something kind of transformational happening here. And that was, of course, what we now know as the GLP-1s, Wegovy, and Zepbound, and other sort of high impact medications. And so when we started this business, we had just a really clear focus on driving results. And we felt like, the data was there. If you looked at the academic data around care, if you looked at the academic data around the impact of high intensity, collaborative, holistic care that took the patient and focused not just on, what's the number on the scale, but what's their whole health look like? What are their comorbidities that are related to obesity and weight gain? What does their family environment look like? What are their mental models around food? If you took a model that integrated all those things, you could drive outstanding results. And back in 2019, I don't know that we had a perfect picture on how to do that sustainably. But what was clear versus the decade earlier when I'd looked at it was enough stuff had changed that there was certainly a path forward. And so, I think getting started, it was the recognition that I think a lot of entrepreneurs have of this feels like a big problem. This feels like a spot that's changing rapidly. And to me, as an entrepreneur, that rapid change is actually often more important than kind of any of the, oh, how good is my idea or how big is the space or anything else. The area was changing rapidly, and we had a strong belief that we could make a real difference.
It was really interesting to see, unlike really anything, when GLP-1s started kind of coming on in full force, there was a lot of skepticism of what is this magic, weight loss drug, but how quickly we moved past that too, right? Because maybe you knew someone that had results with it, and I know someone that had a bunch of results with it that tried things over years and didn't really see what they
Mm-hmm.
wanted to, and
Mm-hmm.
then it then hit. So obviously, first off, you picked the right path because you were ahead of the curve with everything happening and where the industry was heading. Kind of fast forward to today, you recently raised it was your Series B, right? Series B funding
That's right.
round.
Yep.
Can you talk about kind of how that round is going to shape the future of Form Health? Like where you intend to maybe focus investment in, and what's next down the line?
Yeah, absolutely. I think you mentioned how fast this space is evolving, and I think it has changed a lot in a very short period of time, largely based around patient awareness and patient willingness. Uh, Initially, willingness to treat. That is, 5 years ago, we'd say to people, "Hey, there's some great new tools." They'd say, "I don't think I want to take any medications for this." Then it was, "Well, I'm open to it." And now folks come through the door saying, "Hey, I need this specific medication in this specific dosage. I've gone to the FDA website and I figured out sort of what's going to be appropriate for me. Like, doc, let's get this thing going." Right. So wild change in a very short period of time. I think, our perspective on great care, our perspective on great patient outcomes and system level viability really hasn't changed over that time, though. And so I think as we look to this next chapter of growth for the company and where we deploy our capital, we're still just as focused as always on extraordinary patient care and extraordinary outcomes. And the space is kind of in an odd spot today. A lot of the folks that have grown the most rapidly are involved in what's called compounding. This space where they are able to, because some of these medications are on the FDA shortage list, they're able to work through compounding pharmacies, which are appropriate or able to purchase non-FDA approved medications from all sorts of non-FDA approved manufacturing sites, et cetera, et cetera. And not use medications from Eli Lilly and Novo Nordisk, which are the two companies that have FDA-approved medications in the obesity space. And for now, I think these companies have been able, using compounding pharmacy tools, to grow pretty rapidly and really sort of take a lot of the kind of patient imagination around this space. And to your point on change, folks are hearing a radio advertisement. Folks are, filling out an internet form, and then something arrives in the mail, and they're injecting themselves with it, right? And that would have been a crazy thing, even just a couple of years ago, because patients literally have no idea what's in this stuff, and there's lots of great data showing that it's often not what folks think it is. So our focus, with all of this kind of whirling around in the patient space, is as focused on quality as ever, and so we continue to grow our patient base. We continue to grow our physician base. When we grow, we grow with specialist physicians only. These are ABOM, American Board of Obesity Medicine, board certified physicians who are able to look at that whole patient health picture as opposed to just prescribe a script. And then really, I think the big expansion for us is the ability to leverage technology tools to make that experience even better for patients and make that experience even better for providers, so that they can deliver even better results. And so that's sort of the two big areas: expansion of our patient and provider set, and then expansion of the tools that we leverage to make that a simple, seamless experience, whether it's 2 a.m. or 2 p.m.
And correct me if I'm wrong, but with your patients, I thought I read somewhere like less than half of them are taking GLP-1s. If I'm wrong, please
That's right.
correct me on that.
Yeah,
Um,
that's exactly right. And that's one of the great values or great opportunities that comes when you have high level specialized physicians, when you have experts in the space, because our physicians are able to make tremendous progress for patients with patients, even if those GLP-1s are not involved, because we're treating that whole patient, right? And so we get tremendous results with medications that often cost a fraction of that amount, something like a metformin. And I think we're able to make progress with patients who may not have coverage for some of these brand new medications.
and I'm sure, like mind shift, like mindset shift, like plays a critical role in all of this as well. I'm guessing. Can you, I guess, share some success stories with us about maybe patients that would be okay with you, obviously without naming names.
Yeah.
I always think back to that. I don't know if you ever watched Seinfeld. He named name. If you ever seen the Seinfeld episode, I always, whenever I ask that question, you don't have to name names,
He named name.
but yeah, yeah.
Yeah, look, I think so there's look, we've treated tens of thousands of patients over the last 5 years, and the stories often hew to a similar narrative, which is a patient comes in. I would say, in the weight loss space, the majority of patients are are female. We're no different there. I'd say probably, 60 to 70% of our patients are female. Um, Many of our patients are 35 plus in age, right? And a lot of patients come to us because they have tried so many other things. And the typical story is, hey, I've been working on weight loss since I was 14, 15, 16, and I can lose weight for a period of time, and then I regain it, and each time it gets harder, and I'm ready to try something different, right? And I think the aspect of that sort of pre-form narrative that's changed in the last 2 years is I've heard that there's something different, right? I've seen that there might be a path forward here, and that a medical approach can help. And for us, I think the treatment of a patient from a comprehensive, holistic perspective is the thing that really changes the game, right? I'm thinking of one patient who came in who was about 45, had multiple comorbidities, dealt with sleep apnea, had depression, had hypothyroid as well, and in that case, just those comorbidities were driving a ton of weight gain for her, and she was on Prozac for depression, and Prozac itself can be a very obesogenic medication. The average patient on Prozac gains 20 pounds per year over the first 3 years that they're on Prozac, and so we worked with this patient and treated her comorbidities. And only after we felt like we had those comorbidities moving in the right direction did we apply a medication as well for that patient. And the whole time she was undergoing lots of lots of dietetic and activity interactions with her dietitian, her former dietitian, and she was able to make progress over the course of 12 months. She lost about 20% of her body weight during that time. And what we see is that's only possible when you're treating that whole patient, when you're treating those comorbidities, when you're intervening on a dietetic and lifestyle basis. The average real world weight loss for Wigovy at 12 months was published here at the end of last year, and it was 4.4%. And that is a shadow of, I think, what a lot of patients are hoping to achieve. And that's because in the real world, a lot of patients aren't getting holistic care. They're getting a script, and then the doctor says, thanks, have a great day. And they're not treating comorbidities. They're not getting dietetic intervention. They're not getting activity intervention. And so as a result, they're not able to retain on care. They're not able to maintain that treatment, and they're not able to see the results. And I think that's, that underlines the difference, right? When you have wraparound care, when you treat the whole individual, which is how all the FDA studies have been done, right? All the FDA studies are holistic wraparound care. But that's a very different environment than what a lot of patients encounter when they go out and talk to their PCP.
Obviously, telehealth expanded access to care for obesity incredibly, right, over the last few years. What do you see as the future? What future trends should we be aware of in telehealth that you think are going to continue to help improve patient outcomes?
Yeah, I think one of them will feel like a cliche, but I do think that there is continuing real growth of opportunity around a lot of the Gen AI tools that are just coming to market. And you have to be very careful with those tools because of all of the reasons that everybody knows and thinks about when it comes to kind of hallucinations, when it comes to making stuff up, when it comes to drawing from proprietary data, et cetera, et cetera, et cetera. Recognizing all of that, what's unique and different about a telehealth interaction is every single aspect of that patient's care is captured digitally. And as a result, you can have a very different experience, and you can leverage some of these tools to take out the kind of scut work that doctors have to deal with every day, whether that's pre-charting, whether that's dealing with notes, et cetera, et cetera. And I think when you can lift a lot of the load from your physicians of work that isn't productive to that doctor-patient relationship, then you just create a lot more time for the work that they want to be doing. You create a lot more time for high quality interactions with patients. And so, when we work with a patient, we work in a really intensive model. The patient sees the doctor at least once a month for 30 to 60 minutes during that visit. They see their dietitian at least twice a month for 30 to 60 minutes. And so that's a pretty high intensity model. And when the physicians, when the dietitians, when the clinicians can really just focus on that doctor patient interaction, there's just so much more that can be done. And so I think, when it comes to telemedicine, my expectation is, and where we are spending time, is leveraging tools, some of which are Gen AI, some of which are more traditional technology tools, to lift a lot of that scut work, a lot of that stuff that nobody wants to be doing, but that needs to be done, off of the physicians and other clinicians, and allow them to really focus on the clinician patient relationship. And I think, that is something that is going to be uniquely possible in telehealth, because everything is captured through this, electronic interaction. Think about the last time you went to a brick and mortar doctor. They may have spent the entire time looking off to the side and typing into a computer because they had to take notes as the event was going on. But if you have scribes, if you have tools to take notes, et cetera, suddenly you can get back into it with your patient. And that's something that can happen in a telemedical setting in a way that I think is going to be pretty transformational. And to me, that's the next couple, 3 years. Obviously, we still have to make real advances. The folks that are providing these tools have to make real advances, but it feels like they're getting pretty close.
Do you think it could shed the light on certain providers that maybe are brilliant and were great when they were able to take notes when they were doing a consultation, but now all of a sudden they don't have to do that, so they almost have to be, not expecting them to be like this super outgoing person, but probably more so than before, right? Like it's easy to kind of be in your element like this, but then all of a sudden you're looking face to face with them, and are you doing the face where you're miserable when you're talking to them, even though you're not, right? Like I'm not going to say the common phrase for it, but yeah, you know what I mean.
Yes. Yeah. Yeah. Look, I think the job will change. I think the good news is I talk to way, way more physicians, certainly here at Forum. And then, my wife is a physician. And so, a lot of dinner time and cocktail time conversations, here close to home. I talk to a lot more physicians that say, I just wish I could interact with it. I just wish I could have that face to face time. Then I talk with physicians that say, God, these notes are so much better now. I don't have to even look at these people. I think, there's different cliches about roles that different folks elect into. There are plenty of physician roles that are not very patient facing, and I think the good news is the people that didn't want to talk to patients largely have gone off into those roles, and maybe they're doing awesome radiology reads or something like that.
I'm just waiting to read a review where now that I have to talk with my provider, they're great or they're I this is total a different situation than I was used to. We're going to see those reviews though, right? Of once the time comes where they're not just typing on the computer.
Totally. Well, look, I'd say we see that today in a little bit of a different format, and that is, many patients have become conditioned to believe that if you sign up for something telemedical, you're going to have a very short interaction with a physician, and then you're going to get medication shipped to you by mail, right? And there's plenty of folks in our space, in the obesity care space, that do that. In fact, there's many now where you just fill out an online form and you get something shipped to you in the mail, and the results are poor, and it's not clear what's actually in the stuff that comes to you in the mail, et cetera, et cetera, et cetera. But we definitely have patients that will say, hold on, like the doctor wanted to talk to me for an hour and talk about my health history and talk about my sleep apnea and talk about my PCOS. Like, I thought I was just here for the medication. And the answer is, look, if that's what you want, there's plenty of places that do that. But if you want high quality treatment, if you want results that are going to last the rest of your life, if you want to step into a new way of being, then this is the high intensity approach that you have to take. But that's not for everybody, right? And so we do see that. It's it's a different context. It's not because now the doctor can talk to me. It's because, oh well, shoot, I want to take an injection and then kind of get back to doing what I was doing. And the answer is, we got to change a
I love it. Well, Evan, I want to thank you so much for coming on, and I want to have you back on soon already. I think whether that be a panel or we do something else, next time I'm up in Boston area, maybe we can even do an in-person one, which I'm going to start doing
That'd be
more
great.
of. Yeah. But
Yeah,
so
it'd be a lot
great.
of fun.
So great having you, and wishing you the
Great.
best of luck.
I
And
appreciate it.
I'm a fan.
Absolutely. Have a great one. Cheers.